All right, this is a case study walkthrough, and I chose the little guy, the 2-year-old, for the case study, and I tried to make it so that you could see both. On the left-hand side, you've got your rubric, and on the right-hand side is the case study. So I will read the case study to you and then kind of step through what each section in the case study should be for this guy. So he's a 24-month-old Caucasian male brought to clinic by his mom. She states that he's been ill for the past 3 days with nausea, vomiting, diarrhea. She says she thinks she has a fever but not sure because she doesn't have a thermometer at home. She's not given him any meds for fever, and he was refused by daycare because they had a thermometer and said he was febrile. She does not vaccinate her kids, doesn't believe in the benefits. On assessment, he is febrile and he's tacky, and his skin is hot and dry with poor turgor. He appears tired and listless. All right, so now you've got this brief little overview of this child. What would I like to see on a case study write-up? So your introduction, patient history, the history of present illness, and worrisome signs and symptoms. So don't copy word for word what I have already written, but give me a little synopsis, right? The patient for this case study is a 24-month-old Caucasian male brought in for nausea, vomiting, diarrhea for the past 3 days. That's basically, right, your beginning introduction of him. On presentation, he is tachycardic and febrile, and his skin is hot and dry with poor turgor, and the child is listless, period. And that's good enough. That's a great introduction. It's short and sweet. When discussing unique concerns for this guy, the things that are unique to him are that he's young, right? That he is 24 months old, that he's Caucasian, that he's male, and that he's unvaccinated. And those are the main points that I would literally just point them out. And that's it. You don't have to go into great detail about it. But if you choose to revisit it when you start to go into your patient education, this is where you're first introducing that. So that is your first 3 points for case study. Now, your second chunk is worth 5 points. This is looking at the focused health assessment needs. What are you thinking this child needs when you're assessing them? What are those systems you're going to look at, and what do you expect to find? So for him, you're going to most likely want to assess cardiovascular, right? He seems dehydrated. He's tacky, right? So cardiovascular, GI, GU, right? If he's nausea, vomiting, diarrhea, check out his belly. Skin, right? You already know that he's flushed and hot and poor turgor. And you might throw neuro in there. It's kind of up to you, the direction on how you go, right? So you'll just discuss some of the focused health assessment needs don't say I, sorry, this is third person. For assessing this patient would be looking at these systems, and your expected findings would be what, right? He might have hyperactive bowel sounds or a tender belly. He most likely won't have any extra heart sounds, right? We've got no history that would lead you to believe that, so you would notice a rapid pulse. It may be an increased amplitude or decreased depending on kind of how far down the trajectory of dehydration he's gone. He'll probably have decreased urine output, be complaining of nausea, vomiting, right? Even while you're assessing him. And then if you choose to add neuro to your assessment, your list of assessment systems, he's probably lethargic, listless, but rousable. And there you go. So next section, pertinent anatomy physiology. So if you just look at the what happens physically with dehydration, right? If you start to lose volume, blood volume, right, because you are dehydrated, there are a couple risks if you're little, right? You can go into the febrile seizure route if you want to focus on the fever itself. But if you're looking at dehydration or, actually dehydration would be a great one because it encapsulates cardiovascular findings and your integumentary and even that listlessness, right? So talking about how it physically works when your body responds, like you're tacky as your heart tries to compensate for that drop in output itself. When the volume decreases, it'll increase the actual heart rate, right? So cardiac output, stroke volume times heart rate. Like somewhere you remember that? Anyway, so speak to those things, the anatomy, physiology that would talk to you, that would explain his expected assessment findings. And then, let's see, next section, you're looking at priority nursing interventions and recommendations. What is going to happen next? So the kid comes in, you get that brief history, you kind of plan your assessment, and then what? So for this guy, I would expect that you would do fluid replacement, right? Whether it's PO or IV. If you can't tolerate PO, then you'll probably do something for the nausea, right? Then you're going to run some tests, most likely. You will probably do an antipyretic to help with that fever. And if you could get a urine, right, you want to make sure he's making urine still and rule out infection at the same time. So those would be kind of the next pieces that I would expect. Now, if you don't work clinically and you don't know what to expect for this guy, then look to the literature, right? And right, if you have somebody coming in that looks like this, what kind of systems are you going to look at, and what sort of interventions would you anticipate as a nurse? And you can literally search for that and find research if you don't have personal experience with this working as a nurse. Then we got 2 health teaching needs. So health teaching needs for this, and once again, you can take this whatever direction as long as it's supported in your paper. So you can go the vaccination route. If you'd like to teach the mom about the benefits of vaccines, go for it. Great place to put an evidence-based article here, right? Because you need to have some research to back up what you're saying. If you want to discuss the brat diet, right, or fluid management for little babies, or your routine doctor visits for pediatric patients. You choose what you would like to do. What I want to kind of emphasize that you avoid is diagnosing him. You don't want to be going through each patient and going like, what do I think it is? And then I'm going to write up a case study on heart failure or on influenza or, right? So instead, look to the actual assessment findings and walk through that. What does that mean, and how does that look, and how does that change your patient assessment, interventions, and teaching? And there you go. And then make sure it's lovely APA, so you'll have your little cover page and your references beautifully developed and correct. And make sure if you didn't come up with the idea that you cite it appropriately, so that if you didn't come up with the teaching about the importance of vaccinations, right, give me the source. I do not want to see a lot of direct quotes, because for you guys at this level, you should be reading the literature, kind of synthesizing your own understanding of it, and then presenting it. So it's your take on what you've read, but just make sure that you cite it appropriately.